Hi team, and welcome back to Doctor's Notes. In this video, we will address some key terms and terminology when it comes to studying anatomy. First, anatomical position. So an anatomical position is the standard anatomical reference for the human form. What this means is when we refer to certain structures in reference to one another in the human body, it is always described assuming that we're referencing anatomical position. This becomes really handy because there are many scenarios in which describing the location of a structure will significantly differ if the hand was above the head in a raised position versus next to the body, as pictured here. And so anatomical position is the standard anatomical reference. That is, bodies upright, standing erect, the head is facing front, also known as in the anterior position. The upper extremities, also known as the arms, are to the side where the palms are facing forward, and the feet and the lower extremities are positioned, or legs are positioned in such a way where the feet are at mid-clavicular lines. So what that means is if you approximate where the collarbone is, anatomically referred to as the clavicle, approximate where mid-clavicle is, that's where mid-clavicular line is located, and that's where both lower extremities, also known as the legs and feet, should be positioned in order to truly be an anatomical position. There are three main planes in which the body can be divided. This is important, especially when ordering imaging studies, as different imaging studies will require different planes in order to adequately visualize what we are looking for. The three planes are the frontal plane, sagittal plane, and transverse plane. The frontal plane is the cross section that you get when you slice the body from an anterior to posterior fashion, so from front to back. This is the frontal plane. It gives you an image like this, which is one of the images that we typically take when we order a chest x-ray. The other image we typically take when ordering a chest x-ray is one in the sagittal plane, also known as the lateral view. So in this scenario, the body is sliced into cross sections from left to right or right to left. This is the sagittal plane. The mid-sagittal plane will be the plane taken when the cross section is taken midline of the body. Any sagittal plane that's not midline is technically considered the parasagittal plane, para referring to next to midline. The third and final plane is that of the transverse plane, obtained if slices were taken from the top or the superior part of the body towards the inferior part of the body. This is the transverse plane, and it provides an image that looks like this, commonly seen when ordering an abdominal CT and a brain MRI. We'll shift gears a little bit to talk about terms of direction. So this is used when we are trying to navigate through different structures of the body. And so what's really important to understand here is this is all relative. Following the central nervous system, here you have the brain, and then the spinal cord, which travels through the spinal column, ends about here at the coccyx, also known as the tailbone. You're moving towards the head, it's referred to as a cranial direction. Opposite way would be caudal. Now, when you refer to the front and back of the body, there are two ways that we can do this. One is using the words anterior and posterior, that is synonymous with ventral or dorsal. Ventral or dorsal typically is trickier when remembering which of the two is where. What helped me is to Remember that the dorsal fin on a fish is located on their back, and so that's how I remember dorsal from ventral. Overall, towards the top of the body is referred to as superior, while towards the bottom of the body is known as inferior. This has more utility and use compared to cranial and caudal, which is limited to where the central nervous system is located. Then there is proximal and distal, medial and lateral. We'll start first with proximal and distal. Proximal and distal are terms that tend to be used with reference to the appendages. So the arms, upper extremities, and the legs, the lower extremities. The reference here is going to be the core of the body. So a structure that's going to be located closer to the core of the body is going to be a more proximal structure, whereas structures that are going to be located further away from the core of the body, it's going to be a more distal structure. When it comes to medial and lateral, the reference here is midline of the body. Structure that's located towards the midline of the body is going to be a more medial structure, whereas a structure that's going to be located further away from the midline of the body is going to be a more lateral structure. There are several body cavities in the body. There is a dorsal cavity and a ventral cavity. There is a typo here with dorsal. There's only one S in that word. If you recall where ventral and dorsal are located, you can see why these cavities are appropriately named. Within the dorsal cavity, there are two cavities. One is the cranial cavity surrounding the brain, and the other is the spinal cavity surrounding the spinal cord. Within the ventral cavity, there are several cavities. One is the thoracic cavity, located above the diaphragm. The diaphragm is an important landmark for separating the thoracic cavity from the abdominal pelvic cavity. The abdominal cavity is located superior to the pelvic cavity. However, there is no clear structure that clearly delineates the two cavities, and so it's often referred to together as the abdominal pelvic cavity. Here is a lateral view in the sagittal plane of how these cavities look like. This is a transverse section on the transverse plane of some of the key structures located in the thoracic cavity. So here is the heart, here's the right lung and left lung. Within the thoracic cavity are two other cavities known as the pericardial cavity surrounding the heart, cardia in pericardial referring to the heart, and pleural cavities surrounding each lung. There are technically two pleural cavities, one pleural cavity to surround the right lung and the other pleural cavity to surround the left lung. If you look closely, this is a membrane folded onto itself. And so there's going to be one part of the membrane that makes contact with the inner organ. That's commonly referred to as the parietal side, whereas the outer membrane that does not make contact with the inner organ is known, the internal organ is known as the visceral cavity. Let me backtrack. I reversed those things, so scratch the last few seconds and take the following instead. What makes contact with the internal organ is known as the visceral cavity, visceral side, whereas the outer portion, the other side that does not make contact with the internal organ is known as the parietal side. The abdominal pelvic cavity is a large cavity, and so there are several areas that are worth honing into, to be specific. This is really important because when a patient presents into the clinic with a certain pain, it's insufficient to write abdominal pelvic pain. that doesn't tell us very much. And so we use the quadrant system as well as the region system to get more specific. In the quadrant system, there are 4 areas situated around the umbilicus or belly button. This resembles our Cartesian system, where you have the vertical line crossing through midline, and then the horizontal line also passing through the umbilicus. What this creates is a right and left side and an upper and lower side. This creates the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Now, there are certain structures that are located in each quadrant, or that are most correlated with each quadrant. Key ones include the liver and gallbladder, and the right colonic flexure, also known as the hepatic flexure in the right upper quadrant. In the left upper quadrant is where you'll find the spleen and the splenic flexure, also known as the left colonic flexure. The right lower quadrant is the appendix, also known as the vermiform appendix, and in the left lower quadrant, the sigmoid colon. Another way to determine or identify specific areas of the abdominal pelvic cavity is the region system. There are 9 regions resembling a tic-tac-toe grid. The central area, or center area, is going to be situated around the umbilicus, so that's why it's appropriately named the umbilical region. Above the umbilical region is the epigastric region, and below the umbilical region is the hypogastric, also known as the pubic region. Now, on the anatomical right and anatomical left side are specific regions. They're taken in pairs. One is the right and the other is the left. You'll need to specify right versus left because, as you can see, there are 2 very different areas. On either side of the epigastric region is the hypochondriac region. Here's the right hypochondriac region, and here's the left hypochondriac region. On either side of the umbilical region is the lumbar region, appropriately named because this is typically where the 5 lumbar vertebrae will be found, or in this section of the abdominal pelvic cavity anyway. Here's the right lumbar region, and here's the left lumbar region. And on either side of the hypogastric region is the inguinal region. Here's the right inguinal region and the left inguinal region. This concludes topics we wanted to cover to introduce anatomy. Thank you for spending the last several minutes with me. I hope you found this video very helpful. I'll see you in the next one. Take care.